the topic which trying to understand and discuss is can you just stop your video, please, Dr. Devendra? Sorry. Okay. So I have just tried to figure out from where we should start and what are the things which are important in this topic. Actually, this is
Sure.
asked in the multiple times.
Right?
Can you just everyone mute the mic, please? Okay. So actually, as an anesthetist, we are dealing with the patients, and we ourselves are a source of infection in the sense, like all the paramedical staff, they can spread the infection and they can have infection because of the patient. So actually, it's something very important, and there will be certain ways to prevent the spread of infection. There will be certain way to know that what are the deleterious effect of our anesthesia or the condition which we create. Like for example, just to be very simple, all the IV medications which anesthetist is giving, if they are not making it in a clean environment, syringes are not being thrown away after the procedure, this itself can be a source of spread of infection. Of course, the surgery itself, the surgical equipment and everything being which is being used. So there will be certain, in addition to the surgery, there are a number of procedure which anesthetist is doing, like intubation, okay, and the IV cannulation, all other procedure. I'm just giving you a hint of the subject which what we have to do, and all other procedures, okay, like regional blocks, spinal, epidural, and everything. And then you should be thinking that what are the problems which are associated with its there are certain terminology which you should, what do you mean by decontamination, okay, what is sterilization, okay? Disinfection. These are certain terminologies which we will be just trying to cover, okay. Before we just have a look, the equipment which we use in anesthesia may be classified as in the form of the equipment which are passing through the mucous membrane, okay. Just a second. So these anesthesia equipment or the equipment which we use or encounter are divided into critical items, semi-critical item, and non-critical items. Okay? And critical items which are passing through the mucous membranes or that are cutting in, like surgical equipment, cardiac, urinary catheter, central lines, implants, needles. Okay, so these are critical items. Then semi-critical, which may contact the mucous membrane and may not breach it. So part of it is breathing circuits, laryngoscope, fiber optic endoscope, okay, thermometers. They can breach, but usually they will not breach, okay, but it can damage. So intact mucous membranes are generally resistant to infection by bacterial spores, but susceptible to bacteria, bacilli, and viruses, okay. So therefore, these items require at least high level disinfection. And the third level is which are in direct contact with the healthy skin, but not mucous membranes. For example, BP cuff, pulse oximeter. Skin is a effective barrier, so they will be causing. So this is the first step to know what sort of classification of the equipment. Okay. So next thing is that there are 3 or 4 terminologies which you be knowing. What is difference between decontamination? Zishan, would you like to tell? What is difference between decontamination and sterilization?
Sir, in
Disinfection, decontamination is both of them, right?
yes, sir.
So what is difference between disinfection and sterilization?
In disinfection, many of the bacteria and viruses are killed, but the spores are not killed. And in sterilization, spores are also killed.
Okay, so there is a third thing which is not familiar to a number of people. That is, what is that one? Prion. Prion disease, even it is not, the equipment are not free from transfer of prion. We will be just trying to cover it later on. And this is, I had opened it here somewhere. Okay, so prions are not being killed by it. Okay, we will just go slightly. This is a disease which is called as Creutzfeldt Jacobs disease. Creutzfeldt, different people will pronunciate in different way. I had opened it. I don't know where it has gone. Just a second. Yes. Okay. This is the disease I'm talking about. Prion disease. Okay. So it's because this disease was the one which lead to the creation of like concept to use disposable equipments. Okay, like because they are not being killed even by sterilization. Okay. Okay. So yes, Zishan, what are different ways to do the where this sterilization and disinfection?
So sterilization can be done with chemical methods, by steam method, and with certain gases like ethylene oxide.
Okay,
and
so actually,
disinfect.
as I told you that I'm just trying to give you a concept. So I'm like we will go step by step, like because these questions may be asked not in too much detail everywhere, but the first step whenever we use the equipment, first step is cleaning. Okay.
First step is cleaning, then after decontamination, and then it goes after checking that it's decontaminated, then it is packed, and then it goes for sterilization.
Yes. So this is the summary. This is the summary of what we should be knowing about it. Okay. And these questions can come in MCQs as well. Okay. So according to the level of the problem which can be created by different equipment, we will be doing cleaning and disinfection will be done for everything, every equipment, even non-critical equipment. They are being after the use, they maybe even if nothing is there, only alcohol, cleaning it with alcohol will be enough to disinfect. Okay. So this is the concept of critical, semi-critical and non-critical. Okay. So you should be knowing different ways, and of course the too much detail will be that how much is the efficacy of different ways. Am I right, Zishan? So but if you have a concept, you can cover this question if this is being asked in the exam. That, as I told you, that first step is cleaning, in which they are washing it physically with the brush, with anything. If that is failed, then they can do some ultrasonic bath, as I showed it. It's written here. Okay. And then they have to manually clean some of the tubings. Okay. So that which is not being washed by the normal ways. So there are 2-3 ways to do it. The next step will be disinfection. Okay. And disinfection maybe with butylrehyde, alcohol, chlorhexidine. Okay. When we clean the skin, are we doing disinfection or sterilization?
Disinfection.
Yes, disinfection. Okay. So we are using chlorhexidine usually. Okay. Or iodine. So this is the simple concept, and now the process of removing contaminants such that they are unable to reach a site in sufficient quantity to initiate an infection or other harmful. So that is decontamination. Actually, is the process by which you are cleaning it. Okay, so it is not able to reach again to spread the infection. Okay, this is one terminology which I wanted you to learn. So the other thing which you should be knowing, that what are different ways of spread of infection. Okay, just Zishan.
Airborne, waterborne, airborne, waterborne, surface,
Yes, Zishan just try to improve the answer. Airborne. The other is droplet, bloodborne. What else?
instrument,
And contact.
Contact. Okay. So just some example of airborne.
Airborne are viruses, spores of different things, fungi, even bacteria.
Droplet.
Droplet, again, all these things can be droplet borne also. Viruses,
And
spores,
bloodborne. HIV,
blood.
hepatitis B. Any viral infection can transmit. What about corona? Where does
Corona is droplet as well as bloodborne.
Airborne as well as its contact, no?
It's droplet actually. Corona is droplet.
droplet? But if the viral load is too much in a specific area, then I think it become
contact.
okay.
Borne.
Just a second. Actually, I opened one of the page and I closed it, or where it has gone. Yes.
Was with contact also.
Huh?
Droplet and contact also.
Yes. So what are the simple ways to prevent them? How can we prevent?
Number one,
Yes.
barrier methods and hygiene.
So the first thing is hand hygiene. Okay. Then
Barrier methods,
gloves,
gloves, masks, these
shields,
personal
face
protective
shields,
equipment, all kinds.
face shields. Okay. What else?
Sir, reducing the incidence of producing droplet or introduction of
Like, for example, if we prevent airway manipulation, there
so
will be
airway
less chance.
manipulation,
Okay.
oxygenation with open masks, nebulization. These are all that will produce aerosols.
Yes, yes, please. Who is saying? Just who, if someone wants to speak out, just raise the hand. Yes, Sarish.
The negative pressure room in ICU or ICU.
So prevention.
Isolation room.
Yes, very good. Negative pressure rooms and use of disposables. Okay. Use of disposable things will also prevent transmission of the infection and all these things. What else? You know, what are the ways to prevent the bloodborne? Actually, there are IV cannulas in which there is a mechanism and there is a button. Okay, when they press, the needle go inside. Okay, because needle prick injury is one of the cause of transmission. In addition, of course, if the blood they are transmitting a blood with infection, it will be transmitted. So it is proper screening of the blood and like examination and everything. That is one thing. But in the OR, because as a, like you can say, the needle stick injury. Okay, needle stick injury prevention. For that, actually, I told you that there are special IV cannulas which are having spring, and they put the button and the needle go inside. Okay. Yes, Dr. Ahmed.
Sir, is the stethoscope used in ICU एजेंट बन सकता है, फैक्टर हो सकता है कि हम हर
I'm
पेशेंट
sorry.
पे वही स्टेथोस्कोप यूज करते हैं?
I'm sorry, please. You are, if I'm able to understand, you are asking that stethoscope. You are talking about stethoscope.
Yes, yes. In ICU हम यूज करते हैं ना, ICU में एक
Yes,
पेशेंट से दूसरे पेशेंट में वही
stethoscope
स्टेथोस्कोप
is
यूज
one of
करते हैं.
the stethoscope is definitely one of the vehicles for transport of organisms.
Yes.
We
Okay.
have
I hope you got your answer. So actually, stethoscope is like a pulse oximeter or BP cuff, okay, or surface temperature manometer. Non-critical. It is non-critical item.
Okay.
So it is non-critical items.
Every cubicle has its own stethoscope.
Yes. Okay. So when furthermore, if we go forward, that when we are doing this skin preparation with either chlorhexidine or iodine, we are trying to prevent it. Okay. Then what about the dress? The dress, the shoes. Can they spread infection?
Yep.
yes, sir.
Yes,
Okay,
sir.
Or
Yes.
The dress is mostly, but shoes cover can be used.
Yes, but
in
dress
the
and
needle
shoe.
stick injury, for the prevention of needle stick injury, one of the most important points is following proper SOPs.
Yes.
And wearing double.
There is a specific way to cover the.
Handle
Now,
the
boss.
Yes.
Now, the
Yes, Dr.
now
Sam.
the overshoes is prohibited from WHO and infection control. Not
Okay.
allowed to use overshoes inside the theaters.
Yes. Okay. Thank you. So this is one thing. Okay. So actually, this was a very long topic, and I'm just trying to give you a concept. Just a second. Okay. So we will just try to cover this. Up till now, what we have tried to cover, this is that how we are trying to clean, disinfection, inspection. There are specific, because that equipment, they are going back and coming in a special sets. So this is one of the steps. They can ask you the supply chain. Okay. So this is the supply chain of the medical devices equipments. Okay. The equipments, like for example, this bronchoscope, they don't need to have the sterilization though, so they will be disinfection, and they will come back. Okay. So some of the things that we have discussed: disinfection, semi-critical items, chemical disinfection. Okay. This is some slightly more detail about.
Sir, aren't our scopes being sterilized with chemical methods? Glutaldehyde will sterilize also.
Yes. Actually, here they had this. I had just tried to find
Yes,
out.
sir. It's written in the
Yes.
last page of this article.
Okay. So
Glutaldehyde.
yes, you see, this is the question which Zishan was asking, that fiber optic scope, how to clean and disinfect after. So I think some of the agent like glutaldehyde is also causing some sort of sterilization, you mean to say?
Yes, sir. It's written in the article you shared.
Okay. So
Last
they are.
page.
Okay, so they are cleaning it, then they are chemical disinfection with glutaldehyde, rinsing, drying, and transport. That's a way to this clean and make ready this fiber optic bronchoscope for use. Okay. Okay, so which is most effective way? Is steam sterilization or chemical?
Steam, sir.
Steam, sir.
Steam. And actually in steam, there is the thing important is the pressures and the duration, because as much the pressure will be increased, the duration required will be sorry, pressure and temperature will be increased, the duration will be reduced. Am I right?
Yes,
Yes, sir.
sir.
Okay, so this is one thing.
In this
Chemical.
article, only temperature was written, pressure was not written.
I think
Does
I have
anyone know
read
someplace
somewhere
where-
about pressure as well, that if you are increasing the
sir.
pressure, it will also cause something. I need to reconfirm it. Okay.
It was in our microbiology book in 4th year, but it's
Yes.
maybe in very deep in
Okay,
the cupboard.
so this is because they can ask you. They have asked a number of times this question, that after, because face mask, now we can just say face mask is non-critical item, critical item,
Disposable.
or semi-critical.
Semi-critical.
So
No,
non-critical,
it's semi-critical.
semi-critical. Okay.
What do you think?
Face of the, sir, the one we use for ventilation, sir.
But can it touch at, can it cross the mucous membranes or no? If there is in damage,
No.
Sir, if the patient is bleeding from oropharyngeal, so there are chances.
yes, that's what that's what I was thinking only. Okay, so
Yes.
they, you know, the for the prevention of the Creutzfeldt-Jakob disease, now usually these all things are being used as a single use. Okay, there are special face masks which are actually, especially they are perfumed with a taste, cherry flavor and lemon
Yes.
flavor mask. Okay, so the all other equipment like laryngeal LMA, they used to ask still this question, that 39 times and 48 times they throw it. So sometime once upon a time there used to be LMAs like that. Okay, so breathing circuit again is used disposable. Okay, bougies are semi-critical, definitely. Face mask, okay, I think it is
Yes.
non-critical, but this one bougies are semi-critical. Okay, these temperature probes, because temperature probes are though two different, one are skin and one is this one esophageal or nasopharyngeal. Okay, so they are different. Seeing this thing, I think I was wrong. This is not pressure, it is only temperature. Okay, I was mixing it up. So
Pressure is also there. It is also one of the factors.
but because I have read somewhere, I'm not sure about it, so I cannot.
At a certain
15
temperature and
pounds
certain
per
pressure, the time
But I think if
difference
we
is-
recall the law in which one of them should stay constant, no?
Yes, what is that law? I am
It's Charlie's.
yes,
Charles.
this temperature, if remain fixed, pressure is in this Charles law.
Boyle's law.
No, sir.
It's
Charles' law
Boyle's
is temperature is directly
Used to-
proportional to volume.
No, Charles. It's
Boyle's law,
Charles.
Yeah,
Boyle's
Charles
law,
is
we have a
volume.
volume
keeping
and
the
pressure.
Yeah.
Just one person speak out so that there is recalling. See, that's how volatile it is. In Boyle's law, it is inversely, pressure and volume are inversely proportional and temperature is fixed. Okay, and in Charles' law, this one,
It's a volume and temperature.
volume and
is
temperature are
height.
directly proportional.
No, inversely.
Sir,
Inversely,
directly proportional. It's directly
Direct-
proportional, sir.
it is directly proportional. Just a second.
Okay.
Volume and temperature.
Yes, directly.
We are
Yes,
distracted
Charles,
from
is volume
our
directly proportion temperature.
topic, but we will just reconfirm it. Actually, I will suggest all
Okay,
of you to
Sir, I've opened the microbiology book, and it's written that steam at a pressure of 15 pounds per square inch reaches a temperature of 121 degrees Celsius and is held for 15 to 20 minutes.
Okay, so
And
you
when
see,
we increase the temperature,
also
then
had-
time can be reduced.
I also had read somewhere. Okay, so this one, Charles law, at constant pressure, volume of fixed volume varies in proportional to the absolute temperature. So I was correct. It is directly proportional. Okay, so here it is inversely proportional. This third gas law is the pressure of a fixed amount of perfect gas varies in proportional to the temperature. Okay, so it is like that. Okay, so this steam sterilization is being done in autoclaves. Okay, they have written here in about the decontamination process of. Okay, so we will just have a few look at this. What is it called?
These prions will go away with disinfection only, or sterilization will be needed.
Prion
Sterilization.
will not go at all. Prion disease. That's
Even
why
with
You have to
sterilization.
use the disposable things, I think.
Huh?
The disposable should be used for prions, I think.
disposable should be used. Okay, so what is Prion's disease? Is a transmissible spongiform encephalopathy. Is causing encephalopathy. Okay, are a group of neurodegenerative conditions that are transmissible, progressive, and uniformly fatal. It's a very dangerous disease. Okay, and it was you see, if you just have a look on the key points, is caused by the accumulation of abnormal prion protein in the brain and lymphoreticular tissues. And a variant Creutzfeldt-Jakob disease can only be diagnosed definitely by tonsillar or brain biopsy, but a blood test to support early diagnosis is now available. Patients at increased risk of Creutzfeldt disease must be identified and informed that they may pose a risk to public health. The implications of Creutzfeldt-Jakob for the delivery of anesthesia are limited, but the patients at high risk of this variant Creutzfeldt-Jakob disease must be identified, and relevant precautionary measures should be taken. Okay, prion protein cannot be completely destroyed by autoclaving, so surgical instrument may need to be quarantined or destroyed. Okay, so this is something. So what is it? It's a
So I have
prion.
a question about that.
Yes, yes.
How much the percentage is, like how much we should expect it to be in the population percentage?
There
Yes,
have
they have
been
written
only
here.
4 or 5 cases in the world. Only.
Prevalence studies suggest that 1 in 3,000 UK adults may be infected with Creutzfeldt-Jakob prion. It's more frequent than you said, Zishan.
But the actual disease that was found, it was very low.
But the thing is, the thing depends on like the prevalence, like how much the carrier is present. No,
Carriers are present. Okay, so when there is
Carrier.
carrier, the incidence can increase. Okay, so that is what is called as, because I before starting, I apologize that this is a weak topic for me. I had never touched it before. I'm trying my best to do it. Okay, because of course it's difficult for me to read the things which I have not read, or I cannot recall, because the what I'm doing is very difficult. I just came back from hospital. I had a nap. I woke up, and I am sitting in front of you. So sometimes it becomes very difficult. So I apologize for today that I'm not a very good expert of this topic. It's one of the yuck topic for me, but unfortunately, because I have to, you are on the other side, you are listening. So I'm just trying to make it as soluble as possible, because I will just lead you from here. We will go to the other aspects, that is scavenging. Okay, that is how to prevent OR pollution. Okay, so we will just try to expand this topic in a way. We will just try to cover it. So I have just tried to give you a concept. So apologies if I am not performing very nicely today. Okay, so your question is that your point is, Ishan, that the actual infected patients are less, but her point is that if there are carriers, the disease can be there. Okay, so for that, that's why we even laryngoscopes blades, they say they checked it out that the revenue, the maintenance of the laryngoscope blades is also getting too much. So they are now trying to use disposable laryngoscope blades as well. Okay, so that is the only answer is still, even after sterilization, it can be transmitted. Okay, so there are certain diseases actually, whenever they are talking about this dangerous, this is this variant one. Okay, so sporadic, it is what sporadic accounts for 85% of all human prion disease. It predominantly affects those of middle to old age with a this one. The cause of death is unknown, classically present with memory impairment and cognitive decline, accompanied by neurological features such as ataxia, extrapyramidal and pyramidal signs, and myoclonus. The clinical course is usually rapidly progressive, and the patient typically becomes bedbound, akinetic, and mute within weeks to months. The majority of cases are fatal within 6 months. Okay, inherited prion disease accounts for a large proportion of the remaining 15%, and 30 mutations. Actually, this one again. Okay, iatrogenic prion disease can occur secondary to infection from neurosurgical procedures, corneal grafting, and blood transfusion, human cadaveric growth hormone. These are some rare things. Okay, by the same protein that causes this. This is a disease of and cattle. Okay, the number of clinical cases of this is only around 200 to date. Okay, Zishan, just corrected. This was 2013. This article is of 2013. Up to date is there are 200. Okay, majority of cases have been in UK. Genetically susceptible don't get operated in UK, by the way, after reading this prion disease. The first case of was Expo 1995. Okay, so actually because you can say that it's a disease which is transmitted through abnormal protein, that is prion protein, and it is affecting the nervous system mainly. Okay, nervous system and lymphatics, these two things, if you just try to summarize it. Okay, and it will have neurological problems, and it can lead to neurological impairment. This, you see, anxiety, dysphoria, apathy, withdrawal, and insomnia. So that's, and cannot be diagnosed with absolute certainty on clinical criteria alone, and neuropathological confirmation is usually required. However, a combination of symptom and sign assist with defining possibility. They have made some table on MRI, EEG, and CSF prion blood test. They have, I think, they have written there some.
Looks
I
like
pray that
basal
none
ganglia
of.
is involved.
I'm sorry.
I think
Yes.
basal ganglia is involved in this, my MRI.
Yes. I don't think, I pray to all of you that this question is not being asked to you in the exam, because it's a terrible topic. Okay, but I think if I just give you a summary, that as I told you, that you should be knowing that it is transmissible disease involving the neurological system because of a abnormal prion protein, and It is diagnosed with the some neurological symptom and some vague symptom leading to even serious fits and things like that. Okay. So treatment. You see, what sort of disease is it? No treatment. The story is finished. Okay. When there is no treatment, but still there is some way to prevent it. As I told you, that prevention is the main stream for it. They are trying to have this, you see, vaccines, bovine medical vaccines only occur in unavoidable circumstances. You see, I don't think so. They will be. Usman, if you have encountered any question about it, just please help us, because you are in UK, by the way.
Sir, which type of UK I am?
Huh?
Sir, I am not in UK.
I'm sorry.
Sir, I am not in UK.
You are not in UK. You are in Ireland.
No, sir. I'm in Pakistan, sir.
Okay, so I was always thinking that you are in UK. That was my misperception. Any comments, please? We are in help to finish this topic. I'm now feeling dizzy because of because you know that this is my weakness. The thing which I don't understand, I'm unable to explain as well. So that's why I stress to everyone that the thing which you understand, you can explain to other people. I think this chart is important. Okay, just routine contact does not pose a risk. Practical steps and measures for the patient with undergoing surgery. Yes, this is something important. Routine contact does not pose a risk. Preoperative assessment should note neurological impairment, swallowing abnormalities, and aspiration risk. Okay, so this is something the patient need not to have isolation precautions and maybe anesthetized in the induction room, because in UK there is a concept of induction room. Theatre staff should be informed, but there is no requirement for hazard sign. Universal precaution. Yes, actually, this was I missed. What do you mean by universal precautions?
Like it can be present in anywhere in the world. So the precautions are like universal. No?
No. Universal
No,
precautions
it should be in every patient.
in every patient, like we discussed before. The wearing of gloves, mask, okay,
Eye
care of
goggles,
eye
cap.
goggles if needed, this eye shield. These are the things which you can use in any patient. Okay, I think goggles, if you are doing a surgery in yeah, I think yes, do the person who is doing the surgery,
Yes, goggles
yes,
are included.
so gloves, mask, goggles, face shield. Okay, safe disposal of sharp instruments. Inhalational or total IV anesthesia are both adequate. Use disposable airway equipments only. The ventilator need to be quarantined. Suction apparatus dispose of in conventional manner. Low risk surgery procedure like number use disposable airway equipment. Medium infective surgery like PEG use disposable instruments. Endoscope will need to be what is this word? Incinerated.
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 Yes,
or
when it burn at high temperature.
Okay. Oh, I think it is burning. It is the okay.
Yes, burning incinerator.
Okay. High infectivity risk tissues like use disposable surgical instruments or quarantine destroys. Incidental surgery manage instruments according to infective risk of tissues. Large volume of blood and theater drapes should be incarcerated in the conventional manner. Patients may be managed routinely. what message they are trying to give? I don't understand actually. That's the routine prevention they are telling. And if it is diagnosed, then they will be burning some of the equipment. I will just try to get some more information about it and come back, inshallah. Okay. Actually, this is so in our preceding tomorrow or day after tomorrow, inshallah. Whenever next, I will just try to. Zishan, if you can tell what are CVP bundles.
CVP bundle. Okay. So it involves first of all skin preparation, disinfection of the skin, disinfection of the cap of the central line, use of hand hygiene, cleaning hands, use of gloves, and
there is a special
Aseptic measures.
antibiotic coated.
right, antibiotic coated the caps, I think.
No, antibiotic coated dressing.
Dressing.
Okay. So, and if there is any sign of infection, you have to remove it. Am I right? And send the CVP for culture. This is it. Is this part of CVP bundles? I think it is yes. And usually, whenever it is not needed, it is better to remove it. Then not included in CVP bundle is that try to, if you are using it for a long time, try to have this big line. Okay, which will be the chances of infection will be less. Why CVP infection? Because whenever we are passing a cannula, we are entering in the venous system. Am I right? Why CVP is more dangerous? Because directly it is touching the heart, so it can cause endocarditis even. Okay. So that is the reason we should be
review of line daily. The last one is the number one is hand hygiene, then maximum barrier, then skin antisepsis by chlorhexidine, then optimum site, and daily review of line necessity with prompt removal of unnecessary lines.
Yes,
this is
that's what
CVP line.
So actually I have not recently read it, so and another teach it, so I forgot it. So I think this is the same thing which I was telling you. Okay, so CVP bundles, then we will just try to if we can just try to quickly, what is difference between chlorhexidine versus pyridine?
Pyridine is iodine-based solution.
What is the difference? Because actually there are two things: how quickly it affects. Okay.
The chlorhexidine is a bit quicker.
Quicker, but it has more coverage.
More coverage.
Am I right, or just reconfirm it? Because I had opened it.
Sir, I don't think so, because chlorhexidine is preferred nowadays in everywhere.
Actually, I couldn't read it. I downloaded it. I put it in the folder, but I couldn't read it. And it's I again say that it's my weak point. So the things I will try, because I have to cover this topic. So I will just any of people want to comment about it. I think this is a research article. This is not a review article.
Dr. Jamil knew about it. I think he's not here.
Dr. Jamil, yes. Now he is enjoying her just recently passed FCPS. He must be very happy. Anyways, any comments about this chlorhexidine versus pyridine?
Sir, I just knew that the chlorhexidine is now a preferred choice as compared to pyridine.
No,
that's what.
Listen, I tell you something. For this one, there are difference. One is for surgical and one is for anesthesia procedures. Am I right? Or no?
Yes.
There is some difference because when we put it, there are two sort of things which we need. One is bacteriostatic, but one is bactericidal. Am I right? or no?
Yes, sir.
Okay, so there is some difference in it. Okay, just leave this question for me. I will try to find the answer and I will let you know in next inshallah session about this. But I will suggest you people to have a look on this. This is AAGBI guideline for this infection control, and for Neuraxial it is 0.5%. Okay, they have specifically mentioned here. For invasive vascular procedures, 2%. There is difference even in concentration. There is some reason about it. I had known about it, but I don't know the reason. Okay. For anesthesia procedures, chlorhexidine is preferred. Okay.
Yes.
Chlorhexidine is available in Pakistan?
Sir,
Because
no, in my setup it's
Yes,
not
sir.
available.
Yes, sir, it's available.
Sir, Dettol.
Like, sir, in ICU, they use it for oral hygiene, like 0.12%.
No,
And
that is
for
something
the
else.
general,
We are not talking about that. Is chlorhexidine mouthwash is
That is
available in every
mouthwash.
pharmacy. I am talking
Sir,
about
we have it
chlorhexidine.
in its spray form.
Not it's
no,
actually
form
also
is
not.
available.
It's not in the spray form. It is just like a sponge. Just like there is
No,
a.
sir. Here it's available like a spray.
Sir,
But
it is Dettol.
No, please, Dr. Humera, don't come up with a very strange answer. Okay. Dettol is something else. Yet this is something else. So it's not Dettol. Okay. Protocols should be followed to minimize infection risk. We will just reconfirm it. But for the moment, just trust me that for our procedures, it is chlorhexidine. For surgical disinfection, it is pyodine. The reason I will try to find out.
Dettol is, by the way, chloroxylenol.
Your voice is coming very low. If you can speak out loudly, more people will benefit.
sir, can I explain one thing?
Yes.
I'm not sure about once it happened, like the theater got fired because of using a certain type of chlorhexidine that was not supposed to be used on the skin.
Okay.
Like it was for anesthesia use and it was not for the surgical use, and it got fired and the patient was burnt like 80%. So after that, the hospital started to send the chlorhexidine in different, like for anesthesia in different boxes, and for surgical use in different boxes, like the color coded.
Actually, it is color coding. There is a seal. When we are pushing it, there is a plastic seal. When we press it, the seal is broken and the chlorhexidine comes up. Actually, it is available in Saudi Arabia everywhere. So
it
I'm not able.
evaporates. I think that's why it might have caught fire.
Yes. Anyways.
Evaporates like alcohol.
Okay. So we discussed these things: face mask and theater caps, theater suits. You can just have a look at it. Okay. And okay, aseptic non-touch techniques of drugs, antimicrobial stewardship. What do you mean by this antimicrobial stewardship? Anyone knows about it?
This is for the rational use of antibiotics.
Don't use antibiotic without a reason. Okay. What is the role of prophylactic antibiotics?
Sir, before surgery, you were saying?
Yes.
It outweighs the benefits from the risks.
No, actually, no. It's not indicated in every patient. There are some patients in which it will be strongly indicated. Like for example,
yes, like mechanical
neurological
valves.
procedure.
The patient having mechanical valves. Are you talking about this, sir?
Yeah, this is one of them. But there are certain infections in which they are stressing it more. Okay.
Endocarditis, SBE.
Okay,
Subject.
so I will try to have a look at this topic, and I will continue it in our later session. Okay.
So which folder is this app guide
ICU,
guideline
ICU.
available? In ICU, okay.
ICU. Okay. Actually, this is a very difficult topic for me. I will show you this folder. You will go here. You will find here. Okay. It's all related thing. This is nice guidelines. In the guidelines, you just have to see the recommendations. Because actually, I was trying. I wish I could have prepared some in a better way, because I couldn't get the time to study. And these are actually, they have made nice guideline for every. Yes, you see, antimicrobial stewardship is an organizational or healthcare system-wide approach to promote and monitoring judicious use of antibiotics. Okay, so as you were saying, and as I was saying, do not start antibiotic without clinical evidence of bacterial infection. If there is evidence of suspicion of bacterial infection, use logical guidelines to start prompt effective antibiotic treatment. Okay, so and prophylaxis, I had read about it. We will discuss prophylactic antibiotic use in the same session. Okay. Prescribe single dose antibiotic for surgical prophylactic antibiotics have been shown to be effective. Don't be afraid of these big guidelines. You just have to read the recommendation. You will find somewhere the recommendations. Okay. So thanks a lot for the presence. We will continue it from where we have stopped, and I will just try to make it more palatable to you, because that's one thing I wanted to. Okay, so I will stop here, and just I will give you this hint that the things which are related to you see, antibiotic prophylaxis and OR pollution. Okay, OR pollution, and the similarly with that will be associated topic will be scavenging. Okay, and then how to have sterilization or prevention for infection with specific procedure, like for example Foley's NG. I just made a list of the things. So that I was just trying to have a outlook of what I wanted to tell you people. What is N95 mask? Anyone?
How can we define it? It's a mask.
95% protective.
No,
Barrier.
It's
we can
actually a
define it.
size of the particle
It's
which
with
it will
the
allow to
breather.
pass.
Just Zishan, please continue.
It's with the breather now.
No,
breather,
N95. N95 mask, we can define it that it is preventing 95% of the transmission.
Yes, I was right.
Sorry.
Yes, 95% efficient.
Okay. So this is one thing. Then face shield, Google. I just made a list of the things which I wanted to discuss. What is pasteurization? It is disinfection, and it is disinfection of with the temperature. Actually, it is related to milk, right?
First started with milk at 77 degrees Celsius around for 15 minutes. I think it's kept.
Yes. Okay, so we just discussed about this blood-borne, airborne, droplet secretions. I will just try to have a discussion on what should we do when there is needle stick injury. Okay, this is one thing. And what is the role of this HEPA filters, negative pressure rooms, theater environment to reduce infections? Okay, they're like, for example, what about hypovolemia? What effect will have hypovolemia with relation to spread of infection or wound infection? Sorry, sir, this is related to surgical site infection. Is there any relationship between hypothermia and this hypovolemia?
Humidity, sir? Sir, are you talking about humidity?
No, humidity is something else. Yes, humidity will, the optimal humidity, if it is not there, there will be more chances of spread of infection. Okay, but I'm talking about hypovolemia. Hypovolemia.
Hypothermia.
Just a second.
Stasis will promote infection.
Why?
Delayed
Yes.
wound healing will be there.
Delayed wound healing because of
No circulation.
actually I had
Lack
opened.
Lack of oxygenation.
Lack of blood supply, sir. Peripheral
supply.
vasoconstriction.
That's why in some specifically this is true for example, if you want to have, this is also related for example, if there are some grafts, okay, and if you want to improve the graft viability, this is one of the factors is hypovolemia. You have to maintain a good volume and you have to maintain the viscosity, not let it go high, because if there is less viscosity, there will be less blood flow, less oxygenation, and then there will be chances of graft failure. Similar is if there is patient is hypovolemic, there will be more chances of this one infections, surgical site infection. Okay.
Also use of vasoconstrictor.
Vasoconstrictor, it is also true for that. So actually this was my aim. I just
Accumulation of metabolites.
I'm
So
sorry.
there will be accumulation of metabolites.
No,
No, blood supply will be less. It will cause the vasoconstriction of the graft, which will cause ischemia. Might cause ischemia.
Yes. Okay. So that's what I wanted, and we will just continue our discussion on this topic: needle prick injury, drug preparation, sharp handling, and some of the things. Okay. So thank you very much, and inshallah. Okay, Dr. Farhan. Today, actually, my topic again, before I finish, I will just repeat. I need your people help. The people who are have the knowledge. If anyone can help me out, because I don't have time to make presentations, and sometime I don't have even time to read. So whatever I try to deliver, I'm trying to do it. Okay. So thank you very much. Bye bye.